is Latasha Jones. I'm a student with the College of Central Florida, and I'm going to perform an IV administration. I have my doctor's orders, and it states to administer gentamicin 80 milligrams IV. I have my gentamicin medication. I have my drug book here. I looked up the medication. Gentamicin is an antibiotic, and it's normally given at a concentration of 10 milligrams per ml. Further research has shown that gentamicin is normally diluted in normal saline between 50 to 100 mLs. I have a 50 ml bag of normal saline that I will be diluting the medication in. I also have already pre-labeled the package with the gentamicin on it, so once I get into the patient's room. Before I start, I want to go ahead and state the rights of drug IV administration. They are the right patient, the right drug, the right time, the right dose, the right route, the right documentation, and the patient also has the right to refuse. Now, my order states that I should give gentamicin 80 milligrams. The bottle, the medication that I have on hand is gentamicin 40 milligrams per ml. The expiration date is January 15, 2017, so it's not expired. It's a multi-use vial. The contents are clear, and I can go ahead and use this vial. Now, because I have to give 80 milligrams and it's only a 40 milligram per ml medication on hand, I need to withdraw 2 mLs of medication in order for me to get the 80. I've also done my dosage calculation here, just to verify what my dose is, what I have on hand, and the amount that I will take from the multi-use vial. So go ahead and get started. Since this is a multi-use vial, I'm going to go ahead and do my first medication check, compare my gentamicin to my med order. Gentamicin 40, gentamicin. So this is my first medication check. This is the right medication. I'm going to go ahead and sanitize this since it's a multi-use vial. While the medication is in the wrap, I'm going to go ahead and pull back 2 mLs of air. Maintaining sterility, I'm going to go ahead and inject the air into the medication, and I'm going to pull back my medication, my 2 mLs. Recapping, I have withdrawn 2 mLs of medication. No air bubbles, contents are clear. I'm going to do my second medication check. I have my gentamicin, which is the 2 mLs that I just withdrawn. I'm going to compare with my MAR. Should have taken 2 mLs, and I have 2 mLs. And I'm going to go ahead and add it to my medication. All medication has been injected. Recap. And I will put my syringe in my sharps container. Go ahead and lightly toss it to mix the medication. Again, the medication already has been labeled with the gentamicin 80 milligrams. I'm going to just go ahead and compare it again, and I'll take everything and I'll head over to the patient's room. As I'm going into the patient's room, I'll knock on the door. Knock, knock.
Come in.
I'll close the curtain behind me for privacy. The thing on the bed table. Good morning, Mrs. Jones. How are you? Performing hand hygiene.
Good.
My name is Latasha. I'm a student nurse for the College of Central Florida. Can you please tell me your name and date of birth?
Gloria Jones, 7588.
Thank you. I'll compare that to my mark. It matches. Now, Ms. Jones, I'm getting ready to give you your IV medication, your antibiotic that the doctor has ordered. Now, do you have any allergies? Are you allergic to gentamicin or any other antibiotics?
No.
Okay, I've assessed the patient's allergies. She's not allergic to anything. I'm just going to go ahead and elevate the bed. My bedside table here. Patient has a primary line going of normal saline. Gentamicin is compatible with the normal saline, so I can go ahead and connect my secondary to the Y site here. Sanitize my hands again. I'm just going to go ahead and inspect the patient's IV site. She has a continuous that's going. It's flowing good. There's no signs of infiltration or phlebitis. Do you have any tenderness?
No.
There's no tenderness. It's going in and it's hooked up to the primary here. Okay. Before I hang the medication, I'll do my third and last medication check. Gentamicin for Mrs. Jones. It is correct. I have all of my supplies here. In the bag, making sure that this is closed. Hanging the medication. Before I hook up the medication to the Y side, I'm just going to go ahead and prime it. And the line is primed fully. No air bubbles. It's connected. Now, my calculations that I've done, because this is going to be given via gravity, and I'm going to take, this is a 50 ml bag, and the drop factor on the secondary set is 15 drops per minute. If I take the 50 mLs, which is what's in the solution, times it by the 15 drops per minute drop factor, divided by 30 minutes, I will get a total of 25 drops per minute that will be needed in order to give this medication over a 30-minute time frame. So that's about 12 to 13 drops every 30 seconds. So I'm going to go ahead and try to set this. Make sure this is open. Go ahead and set this. it is set. I have it going at 13 drops every 30 seconds, which will be 20 drops per minute. Even though the total is 25, you have to kind of round up because it's hard to get right at 25 drops a minute. So everything's fine, it's running smoothly. Okay, Mrs. Jones, I'm gonna leave you be. If you start to feel funny or you get short of breath or start to have any trouble breathing, I want you to hit this call light, okay? It's right here on your right side, okay?
Okay.
I'll be back to check on you in about 10 minutes or so, okay?
Okay.
Is there anything else I can get for you before I leave?
No.
Okay, I'm gonna put your bed back down. Everything's good. Your bed is down. Remember, your car light is right here on your right side. Go ahead and clean my hands before I leave. I've gathered all of my supplies. Put the overbed table back on the thing. Open up the curtain, and I'll make sure to document.